Cayman's restaurants have always been there for you. A place to get together with friends, to celebrate, to take a first date, or grab a meal between rugby and piano practice. And even though the tables are empty, some kitchens are still full, ready to feed you and your family while keeping you safe and making your meals as delicious as ever. They were there for you, now we can be there for them. While doors might be closed, kitchens are open for delivery. Let's eat.
Also joining us in our studio, our Chief Medical Officer of Health, the Dr. John Lee, the Commissioner of Police, as well as the Director of HMCI, and of course, our sign language interpreter, Ms. Carolyn Powell. We go now first to Dr. Lee.
Good afternoon. I have no routine results to provide for you today. The situation is much as it was yesterday with those people and the reports of the individuals and their health status. The machines at the HSA are going through scheduled maintenance and quality checks today. They have, however, started up the screening of frontline healthcare professionals. As I suggested, I just thought I'd run through the list of people who is going to be screened as part of the first part of this process. All current admissions to the hospitals will be screened. All current inpatients, all staff, frontline healthcare staff, people presenting with respiratory symptoms, or for anyone who has whose healthcare professional has a clinical suspicion that they might have something that is COVID related. Additionally, all inmates at Her Majesty's prisons will be tested as a baseline, and all frontline prison staff as well. I mentioned this as part of the expanded program that we'll be doing for screening, and that expanded program will increase in due course. And alongside that, just to remind you, the information that I said yesterday is that we will no longer be reporting the results. You won't be the first people to hear them at this press conference. They will be sent to the reporting line as they are normally, so they'll be posted in the hospital information system at the HSA. It's called Cerner. The other hospitals have different systems. All be sent out to whichever provider requested the test. Those who are positives will still be contacted, and obviously at the moment those will be contacted by the public health officials or possibly by the provider that requested the test. It depends on the individual circumstances. As far as the hotline is concerned, the flu hotline, the calls continue to drop. There were 16 calls to the flu hotline yesterday and 6 attendees at the flu clinic. So the warmer weather may well be leading to a decrease in the amount of calls on those services. Thank you, Donna.
All right, thank you very much, Dr. Lee. Also joining us now, of course, are members of the media via Zoom. We go first to Kayla from the Cayman Compass. She has a question for Dr. Lee.
Hi, Dr. Lee.
Good afternoon.
I have one quick question for you, and then I have a couple for Dr. Williams if he's available.
Dr. Williams is not available today, I'm sorry.
Okay, no
I might
problem.
be able to answer it. I'll try.
Okay, all right. So you mentioned that frontline staff are being tested now. Do we expect mass testing to begin soon then?
It has begun already. It was started last week. There are several hundred tests that are going to be going through the system, and I'll report on them in due course. What I intend to do is to give a separate report for the screening test, because essentially you'll understand all of these people are well and they're all also in the working population. So I'll give a separate report on that bunch to the bunch that the people that present with some sort of symptoms, or because a medical professional has got some queries for them, or because they are screened as a part of an isolation in a home.
And I want to clarify on the reporting process now that it has changed. At what point in time would new positives be announced at the press conferences, or is that still going to be the procedure?
Yes, it'll still be the procedure that we will advise every press conference of the number of positives that have come forward. That would still be the process, but I'm going to try and split them into the screening ones and the ones that are done for other public health purposes, to give people a better appreciation of if there's prevalence of COVID-19 undetected in the community.
Okay, thank you.
All right.
And I'm not sure if this is a question I was going to, I guess either you or Dr. Williams might be able to address. For Caymanians and residents that might have regularly needed medical treatment off island, how are those cases being managed now? How would are they still able to access medical services off island and return?
For some of those people, a lot of them will be attending outpatient appointments where they are being able to be supplemented with telemedicine in the first instance, just as they are on island as well. So I know that some of the overseas providers are providing telemedicine links to some of their patients, and then they can determine the necessity for a physical attendance. I think all of the physical attendances will be dealt with on a case-by-case basis. It's possible that some of the treatments may be available to be provided, for example, in Jamaica, if there's a reason that we can't send them to the US, certainly in the short term. It's possible that in conjunction with an overseas provider, because we do actually have a very broad spectrum of services available on island, in conjunction with an overseas provider, we may be able to provide that service here, provided it's supervised by the overseas provider. So we're trying to find, on an individual basis, what suits that individual patient. The patient's personal doctor will be the person that will need to manage that situation. It's not going to be somebody centrally that manages that. Just as with all healthcare matters, that whoever is the primary referrer would manage that situation and make the decisions. There could be a need that some people will need to get to the States, and these not by air ambulance, so to speak, but basically they'll be able to go under their own steam, and we are thinking about that, and we're thinking about mechanisms by which we'll be able to make that happen.
Okay, great. Yeah, I'm thinking about cancer patients that might need certain types of specialized therapy in cases like those.
We're very much thinking about that, and how we're going to be able to achieve that. But
we're still getting questions about the schedule for children's vaccines, if that is on track, if families will be contacted soon.
Yes, I think that's more for Dr. Williams. I mean, I know the answer that's been given previously is that they should be contacted. I suspect that if somebody's worried, they should probably reach out to public health and ask them. That would be my recommendation. But for a more in-depth answer, we'd need to ask Dr. Williams.
Okay, thank you.
Thank you, Kayla. Now we go to Ralph from Caymanian Times.
Good afternoon, Dr. Lee. I have one question. With positive cases now at 66, which is about 8% of the total tests, how comfortable are you with those patients who have tested positive staying in their own homes at this point?
That's, again, as with many of these things, there are some people who we've asked if they could kindly go to the government facility. For one reason or another, we've been less comfortable with the arrangements. And so there are some people who have tested positive who have complied with our request and done so. For most people, they're complying really well with our requests, and we have tabs on them, so to speak, not only public health, but we have a broader range of tools and abilities to see if there are any concerns, and we're exercising those tools. But in the main, we're happy with people's compliance.
Thank you very much.
Okay, we now go to Wendy from CNS. Wendy?
Thank you, Donna. I have a couple of questions for Dr. Lee. The first one is just in response to his announcement that they've begun the screening. Can you give us an idea of how many samples have been taken from these people and how many are waiting to be run through the process that we should get results on?
Yeah, so there are, I'm hazarding a guess, around 400 samples that have currently been taken. I would anticipate most of those, the results should be out by the end of this week, because the lab is taking a break, not a break from working, but a break from testing, doing its maintenance things. That clearly there will be a bit of a backlog that they'll need to work through. But it's that sort of order of magnitude. And in the first fortnight, Wendy, we're anticipating that it will be well over 1,000 that we'll be doing.
Okay, great. So far, with the test results that you've actually got, the 700 and odd, have you been able to discern any type of pattern yet as to where those people that have tested positive are? I'm not saying that we want to know where they live. I'm just saying, are we able yet to say we've got a serious amount of people turning up positive in Northside, but we've got nothing in East End, or they're scattered all the way across the island?
They're scattered all across the island. There have definitely been clusters. There's no question about it. There have been some areas that we've known have been linked to a particular event or a particular address for one particular reason or another. So there are definitely, as you saw, the potential we saw the other day at in Georgetown at the apartment complex, that didn't actually turn out to be. It's really pleasing that it didn't turn out to be a large cluster, but that's the sort of thing that we've seen in smaller ways, but it's across the island. Sorry, not plural.
Okay, and the last question is just really just to clarify: have any curfew breachers ever been tested? Do you know that? I don't know whether that might be a question for the commissioner, but
I definitely think it's a question for the commissioner.
If somebody's breaching curfew, then they do. If they were to be positive, then they're posing a real risk. And so I just wondered if that had been part of because obviously it wouldn't fit the PAHU criteria. So I imagine the answer is no, but I just wanted to check.
We do get queries from time to time from the security services about whether the officers should be concerned, is an individual at risk, and so on and so forth. And we answer the question as with as much information as we needed to give them comfort. But as far as I'm aware, Wendy, there haven't been.
Okay, that's it. Thank you. Appreciate it.
Okay, thank you, Wendy, and to the rest of the media. We're now going to call on the Commissioner of Police, Mr. Derek Byrne, for his update.
Good afternoon, and very little to report this afternoon. So very quiet overnight, no significant issues of a policing nature occurred. Crime remains very stable and the hard curfew continues to operate well. Overnight on Little Cayman, no issues occurring. Cayman Brack, 10 vehicles stopped, no breaches of curfew detected. Grand Cayman between 6 p.m. and last night and 6 a.m. this morning, 341 vehicles were stopped by police. One driver was found in breach of curfew and warned for prosecution. Since 6 a.m. this morning, there has been a lot of traffic on the roads throughout Grand Cayman. Only one person found in breach of shelter-in-place regulations and issued with a ticket. This morning, our police helicopter performed a medevac of a male patient from Little Cayman to Health City. The transfer went without incident and was not COVID-19 related. This morning, business at supermarkets, banks, pharmacies and gas stations are operating well. They're being well managed, well controlled. Social distancing protocols are being followed, and our helicopter and marine units remain deployed on extended tours, monitoring marine and ground activities. The usual daily reminder: we return to hard curfew at 7 p.m. this evening through to 5 a.m. in the morning. This is a hard curfew, and no persons other than exempted essential services personnel on duty should be out and about away from their homes during these hours. If you are not an exempted essential services personnel, please stay at home. Exercise in public places tomorrow will be from 5:15 a.m. to 6:45 p.m. Tomorrow, public beaches remain in full hard curfew and lockdown. Police mobile and static patrols remain in place across the islands to enforce the curfew and shelter-in-place regulations. Nothing further to report. Thank you.
Okay, Commissioner Byrne, we have a question from Kayla from the Compass.
Hi, Commissioner.
Kayla.
I wanted to ask about permissions that people have on their designated days by last name. Would business owners be authorized to check in on their properties just to make sure that everything is still there? There's no emergency maintenance that needs to be done.
So the appeal we've made over the last, I think maybe yesterday and maybe late last week, was make contact with us if you have concern. Many businesses have private security in place, so it's pretty easy to find out if the business is intact. For those that don't have private security, contact us and we'll meet you on site if it is your day for being out and about.
Okay, great. Thank you for that clarification. And I wanted to touch on the team from the UK that's coming. I imagine that they'll be working in some capacity alongside RCIPS. Is that the case?
Yes, that's the normal. This would happen annually. We receive a military team in advance of the deployment, normally from Mounts Bay or whichever ship is coming. We come, meet them, discuss logistics, planning, issues of concern, mainly in planning for hurricane season. This year we have the added COVID-19 issues we're discussing. So yeah, it's very much working in collaboration, partnership with them. I've been in touch with all my colleagues from the British Overseas Territories talking about this, and all the territories are looking for assistance just in terms of planning, scenario-based planning, what could happen. We work on a red, green, amber, and black system, and we're in amber at the moment, so we have to figure out whether we're moving to red or black. And all this logistics then, sitting down, will tell us where we should be going.
Great. And sorry for my ignorance, but what does amber mean?
It means that the
Which
state...
color?
So exactly what it means when we're looking at it, it's a risk matrix, and it means that we're in a normal state of policing, that we don't move to red where we're experiencing severe impact. And black would means that we're at demands that are at a level where the business as usual cannot be sustained. So we're in amber, we're in normal policing times, crime is stable, policing is stable. Next stage is there's a severe impact on services. We haven't arrived there, but we need to plan for that as part of our risk mitigation, business continuity, contingency planning. And black then is when basically everything fails and we need as much assistance as we can get.
Okay. So yeah, I know there was some concern when this announcement was made that maybe there were security concerns here, but it sounds like from what you've said that this is kind of part of the standard ramp up that would be happening before hurricane season anyway.
I think security is just a global reference to, the range of services that these people can provide, logistics, communications. I will have some issues with my helicopter during the summer period because of servicing, with one being off island, being retrofitted, and the other one having to go for service. And some of the discussions taking place with the visiting team will be, how can I use the services they have here to maintain helicopter cover here on island?
Thank you, Commissioner.
Thank you very much, Kayla. Now we're going to go to our panel, beginning with the Honorable Premier.
Thank you, Donna. Hello, everyone. I have a number of things to talk about today. We've just finished a meeting of the Cabinet, and we are now ready for the meeting of the House, which will begin tomorrow and continue on Thursday. Tomorrow's meeting is one of those unique, never been tried before sort of meetings. We are doing our very best to ensure that we comply with all relevant advice and guidance with respect to physical distancing. So we've worked out an agreement between the government and the official opposition and the other members of the opposition, so that we will have 6 of the elected members of the government present in the chamber, along with the Attorney General. And we will have the leader of the opposition and other member of the official opposition, as well as the 2 independent members of the opposition, and then 1 other member of the opposition who will take the chair. And the purpose of that meeting is to recommend to the Standing Orders Committee, which is a committee of the whole House, that standing orders be amended to facilitate the holding of a meeting by electronic means, or in other words, a virtual meeting. So once that has been done and the Standing Orders Committee has agreed the terms of that amendment, the House will then vote in favor, I hope, of it, and His Excellency will be asked to approve the change in standing orders to facilitate a substantive meeting of the House on Thursday, during which we will consider, among other things, the election of a deputy speaker, a change in the membership of the business committee to reflect other changes that have occurred in the House recently, and amendments to a number of pieces of legislation, all of which I have spoken about in previous press conferences. Amendments to the traffic law, amendments to the labor law, amendments to the national pensions law, and amendments to the customs and border control law. I'm hoping that all of that goes smoothly, as all of the changes that are being proposed with respect to the legislation are necessary to give effect to or to address a number of the concerns which currently arise. I don't know if I need to go into too much detail about those changes again today. I'll leave it and see if members of the press or the public wish me to answer questions, as I've gone through those before. I want to say a few words, if I can find my notes, to Caymanians who are elsewhere than the Cayman Islands during this time of world crisis. We've spent a lot of time talking about Caymanians here and how we can get more Caymanians back here that need to get here. But we really haven't spent much time talking about and addressing or asking ourselves even how Caymanians overseas are coping. And I'm sure many of them may be feeling quite disconnected and perhaps a bit uncared for by us. I just want to make sure on behalf of the government that they know that we are concerned about them and their welfare. And we understand that there may be a whole range of reasons why they are not here or will not be able to come home during this time of crisis, whether it's their job or their education or putting their family at risk, and so many of them are remaining overseas. But we want you to know that we still love and care for all of you, and we want you back home in due course. I also want to say that the Cayman Islands Government Office in the United Kingdom continues to do an incredible job, not only assisting Caymanians over in that part of the world to get home, but they're also on hand to support those who remain in Europe. There are a number of initiatives happening over there, including weekly Zoom calls for Caymanians who may want somewhere to turn or just to hear a friendly Caymanian voice. And I'm also very interested to learn, as I love the kitchen myself, that they're also doing interactive Caymanian culinary Zoom calls about how you cook up some good Cayman food in an overseas kitchen, with having to make some creative choices with respect to some ingredients from time to time. So if you are a Caymanian overseas in Europe, please do communicate with the Cayman Islands Government Office over there and join in with the Cayman community things that are going on virtually. I again want to thank Andre Ebanks and his staff in the office in London for the stellar work they have been doing all along, but particularly in this time of crisis, and for supporting our people in the UK and keeping them connected. I also want to finish my little spiel today with a shout out to my girlfriend, who is 102 years old today, Miss Ethel Ebanks. I had the privilege of attending a number of her birthdays, but most recently her 100th birthday. And she was and still is in incredible form. I know this is quite lonely for her because, given her age, she is pretty much all alone, and family and friends would not be able to gather with her today. But there are a lot of people who love her very much, and I'm among them. And it is, it is for people like her that we all must stay home and keep Cayman safe. Every life matters. There's an African proverb that says something like this, that anytime an elder dies, a library burns down. And that's really how I think we need to view our elders always. They're an incredible resource. They have lived lives that younger ones will never live, have had experiences that younger ones just will never have. And they enrich us, and they enrich our community. And we must continue to value and preserve those lives. They are as precious as those of younger people.
Okay.
Thank you. Thank you very much. And let me first of all add my best wishes and birthday celebrations also to Miss Ethel Ebanks on reaching 102. Our very, very best wishes to you on this special day. I just want to make an announcement, first of all, about the British Airways Airbridge, just to confirm that it will arrive next Tuesday. We'll be bringing much needed medical equipment, as I have said before, including extraction kits and swabs, and we'll bring a number of Caymanians back here, as we have said previously. All those who have registered with the emergency travel line will be sent a link to book tickets on that plane. And then we will be sharing the website. It's a new system for booking the tickets this time. We'll be sharing that website with the general public. I hope that will be tomorrow. So there is no need to contact the travel helpline at the present time. And just to confirm again, yesterday I said we will be able to take pets on the flight, and the details of how to do that will be forwarded with the link. Secondly, I want to refer to the announcement that I made yesterday about a small planning team, which will be deployed to the Cayman Islands next week. And the police commissioner has made some reference to this already today. As I said yesterday, a similar team has already been sent to the Turks and Caicos and has been there for 2 weeks. I've said repeatedly in recent weeks that I believe that our law and order situation is stable. I'm very grateful to the police commissioner and everybody for the work they do on that. And I have confidence in our capacity and capability to manage any risks moving forward. But this situation is unprecedented, and all my experience of handling crises underlines the importance of being prepared for any eventuality. So this small military, civilian and logistics team will support us on sensible scenario planning. It will provide expertise and resource to ensure that we are and can manage those risks on curfew handling, the prison, economic and social factors. And I believe this will be a really important resource for us to have at this present time to manage our security needs, the COVID-19 risks, and also to assist on hurricane preparedness, including coordinating with other UK assets in the region. So the team will also have medical and security planners and logisticians who are professional experts who can support us on some of the medical supplies that we are bringing in to the islands. And as I said yesterday, I do think this is a strong signal of UK support. I just want to make 2 other brief comments. First of all, Cayman has an excellent reputation for responding and preparing for disasters, for hurricanes. And we have Danny Coleman here, HMCI, and they have been working incredibly hard in recent weeks. So this team will also help provide some resilience to Danny and her team. And Danny has worked closely with the UK Ministry of Defence for many years in advance of hurricane seasons. And I do want to recall again, last year we had RFA Mounts Bay come to Cayman, landed on the beach with equipment and personnel. And we have 2 Royal Navy ships in the region, and coordinating with those ships is extremely important. And as the police commissioner said, we may be able to have some cover from one of those ships, as they have helicopters when our own helicopter needs to be off island. And then my final point is just to say that, yet again, our defence regiment, which has 9 officers and was getting itself formed, they have been helping out really well in this crisis so far. The commander has been involved on logistics, and the officers have been involved in some of the back office work. And the team that's coming out from the UK will be able to work closely with the regiment, and the regiment will liaise with them and support them. So that will also bring us some medium and longer term benefits as well. Thank you.
Thank you, Your Excellency. Minister of Health.
Thank you, Donna. Good afternoon, everyone. In Grand Cayman, Cayman Brac, and Little Cayman. I was also asked to acknowledge the Caymanian diaspora around the world listening in. Thank you for listening. Also want to express my birthday wishes to the young lady, 102 years old, Miss Ethel. Happy birthday to you. Scripture reading today comes from Joshua 1:9. Have not I commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord our God will be with you wherever you go. In our efforts to have people stay home, which is one of the main ways to keep this disease from spreading. In Portuguese, meaning in honor of Brazil and Portugal. Let's see where you know this now. I know a little bit Portuguese. Por favor, fique Tolong tinggal di rumah. I thank you. I want to shout out all those companies who are delivering groceries and supplies. What you're doing is so important, especially with the taxes and the public transport being suspended. I thank you very much for delivering to especially the needy and to the elderly. It's very important that we take care of this community. All of what we're doing here is so that something doesn't actually happen. So it may seem a little harsh, but it will pay off in the end, as we've been saying. It's some pain for more gain a little later. And I know there's a lot of questions been coming in, a lot of calls we've been getting. The government, everyone has an idea of how, the government should be handling certain things. And a lot of, I actually, I ask you to continue calling and continue sending the messages, because as you've seen, a lot of the suggestions that you put forward has been used, but not everything that you suggest, because there's a lot of things that we have to put in consideration when we're making decisions as to what we do moving forward, especially in this time, as the governor mentioned, unprecedented times. And we're human, and albeit we have our technocrats and we have we get advice from not only here but around the world, and we try to make the best decision possible, whether that's pensions or otherwise. And we ask you to pray for us continuously. And what you may appreciate is that when you hear us make a decision, and normally the decisions that we make are for 2-week bans, but it's not permanent, and it's a fluid situation, and we won't be able to please everyone. Nothing anyone has ever done in the world has pleased everyone, not even Jesus. So we understand that people will have concerns. There are things out there that we never thought of, that things that we didn't think of, that are affecting you at home, and you know, please ensure that you call someone, call one of the numbers that we put out there for you to get the necessary help, the necessary attention that is needed, for us to look at your situation, or if there's a group out there that we missed out, you know, reach out to us, in the spirit of us trying to find a way forward, not in a vexatious spirit, um, but in a spirit of unity and love, of us trying to help you find a way forward. The police isn't going to always get it right. They're also human beings, but they try. And, you know, the commissioner is here, always talks about common sense approach, and, you know, trying to help understand, you know, what you're dealing with out there. So I thank you for all the support, that you've been given the government and all the frontline workers out there. In fact, when you come to a roadblock, just say thank you to the police officers, to the frontline workers, the CBC workers. Say thank you to them all. Say thank you to the cashiers at the supermarkets who put their lives on the line every day, to serve you. And, you know, these people have families too, you know, and their families need them. So let's say thank you to them. Give them a smile. Let them smile also. So, also saddened to hear that Reshma's, who's normally with us, she had a close family member passed away. We express our condolences to you, Reshma. Also, Premier had mentioned about the pension fund, and we've been getting a lot of concerns and a lot of questions about the pension fund. And we want to say, if you don't need it, don't use it. For those who need it, ensure that it goes to good use. You don't want to be looking back 1 year from now and shoulda, woulda, and think about how you could have used it much more wisely. We don't know how long this coronavirus is going to last. We don't know if it's going to spur up again. So you need to be very wise about your spending. Even if you get a big payout from your pension fund, please use it very wisely. And also remember that if you get the money, you don't have to use it. You can actually put it right back in, to your pension fund. So that's, everyone have their own situation. Everybody know what they're facing. But I'd say to you that these are some of the considerations when you're talking about whether you need to take from the fund or not. Questions to ask yourself is, if you're unemployed, it's suggested to take the pension fund, because you will need it to survive. And you know, you only can get so much from NAU. If you're laid off, you probably need to take it. If you're in the tourism industry, it's probably a good reason. Again, if your business is closed due to COVID-19 measures done by the government to save lives, then you probably need to take it. If your if your livelihood depends on opening of any of the ports, the airport, the seaport, you probably need to take it. If your business is still going, but 90% of your business is lost, then you probably need to take it also. These are some of the considerations that we are trying to reach people that that actually need it. If you don't need it, don't use it. If you're still employed and your household is still employed, don't take it. This is only my suggestion. I don't know your situation, but you know, later down the road, you might regret using it at a time when you didn't need to take it. So I am all for using the pension fund for this time because it's in a need. It's a need. And what I don't want is for people's lives to be lost because of starvation and hunger. So I understand that some people need an injection of cash. So I'm just saying to you, be wise. Be wise about it. The chief medical officer mentioned earlier today that the expanded testing regimen has started. This is great news for Cayman. The government will be better able to make plans with more understanding of how our community is being affected by this coronavirus. As the saying goes, being forewarned is being forearmed. And this is only the first stage of testing. As time goes on, the plans will expand to include more of the community, including people who face the public on a daily basis, like supermarket workers. It has been a collaborative effort between the private and public doctors and nurses from both primary care and the hospitals. I applaud the approach against this national threat. There are some key players who have really been instrumental in this fight, some better known, others less known. I thank you all. I just wanted to mention a fact that you might not know. In our laboratories, we have not one PCR machine, but 4. 3 at the HSA, including a new one about to be commissioned, and 1 at Doctors Hospital. We also have 6 biosafety cabinets available to test for COVID-19 across the 3 hospitals, 2 of which are new and soon to be commissioned. We have also been working diligently with the Cayman Islands Red Cross and volunteers to make masks and in turn give them to essential frontline workers, staff, including police and prison officers. The goal is to make 4,000 masks, and last Friday we were able to give 350 of them to frontline staff. I want to thank Dr. Lee for encouraging this initiative. Cayman Islands Red Cross, its 100 volunteers and everyone who has been involved in bringing forward this initiative to produce these masks locally. Let me take this opportunity to remind people that wearing masks in public is only an added layer of protection from the coronavirus. Still need your 6 feet social distancing. Must all still be aware of the limitation of masks. We do not want you to get complacent and have a false sense of security of masks alone. Staying at home is the best form of defense. But when you do have to go into public spaces, wearing a mask along with using your social distancing, staying 6 feet away from each other, and practicing constant hand washing hygiene will be the most effective way to help us reduce the risk of contracting this disease, especially now that we know there is a community spread. In fact, I'd say to you, in my humble opinion, that wearing masks and social distancing and washing hands for hand washing hygiene will be here to stay for some time, if I'm being honest. Remember, 6 feet to save lives and staying home is Cayman kind. I thank you and God bless.
Thank
Donna,
you.
could I just come in very briefly?
Absolutely.
Just before we go to press, just to say that we quite rightly celebrated Miss Ethel Jones' birthday today, but it is also Her Majesty the Queen's birthday today. I think we're used to celebrating that in June, but her actual birthday is in April. So I'm sure everyone on the islands will join me in wishing Her Majesty the Queen a happy birthday as well.
Yes.
All right. Okay, thank you to the panel. We're going to go to question time now with the media. We're going to begin with Felicia over at Radio Cayman. Felicia?
Hi, good afternoon. My question is for the Premier. As the restrictions continue, a number of people have asked for your assistance to help them through this time by providing greater access to things that will make it easier for them to stay home. For example, the ability to order items to prepare for the upcoming hurricane season, or to work on their properties, create food gardens, etc. They've cited that the fact that the alcohol access, it's easy to get to it, but it's not easy for them to get access to a hammer and nails to repair a leaky roof. Many people are cooperating and do see the bigger picture, but they just feel that it would be easier for them to stay home if it was just easier to get access to some of these items. Is there any possibility of compromise that will accommodate both needs?
We haven't worked that out. Actually, opening more stores is not going to cause people to stay home more. It's going to cause more people to be on the road and congregating. We are at a very critical point in an assessment of this crisis. You would have heard Dr. Lee say we are in the process of mass testing now, and there are some 400 plus tests awaiting, or samples awaiting testing. I would venture to say that by this time next week, we will have a very good idea of the prevalence of this virus in the community. I remain hopeful and indeed prayerful that we are not into sustained community transmission. If we are, the last thing we want to do is to be opening more places for people to congregate and for the opportunity, or for further opportunity for community transmission of the virus. So if I can just ask everyone to remain patient. Believe you me, I know it's very stressful, it's very frustrating. There are lots of things I would like to do, lots of places I would like to be too, but I just can't. None of us can, because it's just not available. But it would be senseless if all the efforts, all the sacrifices, all the frustrations that as a community we have gone through and are still going through were to be for naught, because we made a wrong decision at the wrong time to start opening up the community and increase the chances for community transmission of the virus. If the tests indicate to us that while there is transmission and while there are cases, it is not widespread, we can then start to look at what areas we can ease some of these restrictions on. But as I think everyone who's paying attention would see, in countries where they have eased the restrictions too early, they're all facing a second wave of infections. And in two instances, they've had to shut back down, lock back down to save lives. So far, we've only have the one life that was lost, which was an imported case. We really would like to keep it that way.
Thank you.
Okay, thank you. That's all my questions.
Okay, we're going to move now to Ralph from the Caymanian Times. Ralph?
Hey, good afternoon, Mr. Premier. My questions are for you, and I say good afternoon to the rest of the panel as well. The last answer that you gave actually covered one of my questions, but just to add to that, we are seeing a significant level of preparation by law enforcement for the hurricane season. Have the other areas of have hazard management started to consider making similar preparations for the upcoming hurricane season, taking into consideration that we may be at curfew, may still be at a curfew at that time?
Well, we have Danny Coleman, the director of hazard management here, so she can answer that question.
Thank you very much. Thanks, Ralph, for that question. Yeah, hazard management is working very closely with Public Works Department to identify more public shelters. Obviously, we've got quite a task on our hands with shelter capacity increasing. What we currently have is 8% of the population in Grand Cayman. So we now have to look at shelters with COVID in mind and social distancing in mind. So it's quite a big task, but we're doing that. And again, we're working on inventory supplies as well. So hazard management is working very closely on the hurricane preparedness, and we'll be doing a lot more messaging coming up soon.
Thank you very much.
Thanks.
And thank you. My second question and last question for the Premier is, we've been attending this press briefings for over 4 weeks now, and I've heard your pleas to the community. Do you believe that the major portion or the majority of the residents here are really taking your warnings and recommendations and orders seriously?
Yes, I do. Although I have to add that we still receive, even from people who are taking it very, very seriously, as the question by Felicia just now indicated, there are still lots of people who feel that they should have access to a lot of things, and I understand. And they seem not to appreciate that precisely what they would like to do significantly increases the risk of them contracting the disease. Anytime you go into a closed space with other people, you have significantly increased your chances of contracting the virus if there's someone in there that does have it. The only way that you can ensure that you don't get it is to stay away from other people. And people still want their creature comforts, still want, especially their home. I understand they're bored, they want to do some work on their house that they haven't got done, and now they're home, they think they can do it, but they can't get access to the things they need. Believe you me, I understand all of those frustrations. But we really need to get a better grasp of where the virus, the extent to which the virus is in the community, before we can safely make decisions opening up things more than they currently are.
Thank you. So just to confirm, the results from Dr. Lee and his team will significantly impact the decision going forward.
Absolutely. As he said, by this time next week, they should have taken more than 1,000 samples. Quite how many of those they'll have processed, I can't say, but there will be a significant number. And I think because we're dealing with frontline staff, we should start to get a real indication of the prevalence of the virus in the community. One of the great fears, and I'll confess this, that I have, is that a significant percentage of people who do contract the virus are asymptomatic. And as I've said more than once, in many cases, they won't even know they have it, but they pass it on to other people, and some people really react very badly to it. The only way to know if an asymptomatic person has it is to do a test. So we are testing now, not just those people who present with symptoms or concerns that they might have it because they are a contact of someone that they know. So we believe that will give us a pretty good idea of where we are in terms of risk, and allow us to make assessments about what we can or what we should and should not be doing in terms of further or restricting or lessening the restrictions on movement of people.
Thank you very much. That's it for me, Donna.
Okay, thank you. We're now going to move on to Wendy from CNS. Wendy, go ahead.
Thank you, Donna. I've got some questions for the Premier. Have you got an idea in mind, Premier, of the number of that you would like to see of frontline workers that would make you feel that you had a really strong handle on the spread?
Well, I think we're looking. Dr. Lee, is he still here?
Yeah.
He sure is.
I think Dr. Lee is better able to answer that than me because we are guided by the medical advice on these things. So.
Hi, Wendy.
Thanks, Dr. Lee.
We clearly we're doing the people who are front-facing initially, but we're thinking about even larger surveys. You know, whether we might look at the a proportion of the whole of the construction industry, for example. We haven't yet begun having discussions, but it's or whether we should look at a population-wide survey. These are the sorts of the things we're thinking about. It's the sorts of things that you'll see being discussed around the world as the best way to try and get a handle on it. I think but we're waiting to see what the initial results of the first screenings show to really guide us as to how much further effort to put into this and in which particular direction we should go. We have not yet got a hard and fast protocol for what the future testing will be, but there are lots of the things that I've just discussed we're thinking about.
So when, if I might add to that in my unscientific way, the current testing is the results are showing about somewhere around 8-9% positive result with respect to the tests. And I know a number of people, because I've had the correspondence, the messages are extrapolating that across the entire population and saying, oh, we're really in trouble because if that is, as we believe, they say, if that is representative of the spread of the virus through the community, we're really in trouble. I don't think that is representative because all of the people who have been tested have either been symptomatic or contacts of people who were symptomatic. So I would have actually expected that number to be higher, to be truthful. But then again, I'm no scientist. So a broader sampling of people who are, at least on first blush, healthy, I think will give us a better indication of the likely incidence of the virus in the broader community. Dr. Lee, if I got that wrong, please correct me.
Before Wendy moves on, I actually have a question for Dr. Lee from the public. It relates to those persons in the public who may have had, let's say, their annual flu shot, and persons would like to know whether there's a correlation between the getting the flu shot and getting the test for COVID, and whether there could be some kind of a link for persons who getting COVID who may have had the flu shot, if that makes sense.
Yeah, I don't know of any link of that kind. I also wouldn't see how that would happen. I wouldn't, and I've not heard or read of any sort of a link between that. I had the flu shot.
Okay, and you're good.
You are.
Thank you very much. Dr. Lee, thank you for that. Wendy, you can continue, please.
Oh, yeah, thanks for that. I'm moving on now to the pensions. We've had a few people contact us today, and it appears that some pension fund companies are going to make people wait for 60 days, I mean, effectively 2 months before they can touch their money. Is there anything you can do about that? Because I think some people are probably going to find that a little bit hard.
No, if they do that, they'll be in breach of the law. The law says they have to do it. It's 45 plus 7 days for the application. 45 days, they've got to pay the money out. So that's
you said 4 to 5 days there, not 45.
45. I've got the bill here with me, but yes, it's 45 days.
So it's still like a month and a half then.
Yeah.
Okay.
But
Um,
we have to remember now there are likely to be significant numbers of applications, and they got to be processed and validated, processed, validated, and then checks cut. So
okay. So that's the way it is.
mhm.
Okay, the only other one was a small sort of technical query. Some people who have changed jobs recently now are in a situation where they actually have two pensions, which is one that they've maybe only paid in for a few months, and then another one that they might have paid into for years. Will they be able to access the bigger one?
I would have thought so. That the law doesn't make, the amendment doesn't make any distinction between various accounts. So it says that you,
Right.
And I know they meant some, I know of one person that has 4 different accounts at 4 different pension providers. So because of their work history, right? So that sort of logistical administrative stuff they'll have to work out between themselves. But I would have thought it was the aggregate aggregate sum that would determine how much they can actually take out.
Okay. Thank you. I have just one question remaining for Minister Seymour, which is about when tomorrow is Earth Day. So it just seems appropriate because this question has come up a lot, and it's perhaps not the most important thing ever, but it is still an issue that people are concerned about. What's happening regarding recycling?
Yes, we know tomorrow's Earth Day, and the chief officer has already contacted me about that, so I should have more to say about that tomorrow. And the recycling only paused because of coronavirus. I've asked my the policy officers to communicate with the committee that we had going. We had the committee going and had to end abruptly because of coronavirus. I've asked them to communicate with them to let them know that even though we weren't meeting because of coronavirus, that we had enough information for us to continue working on a paper for us to get something to caucus and cabinet. I think we had done a press release with enough information for us to be able to continue. So I'm hopeful. As you know, the building is almost empty. Most people are working from home, but I pray that they're still working on that also.
I assume you're talking about the plastic. Actually, what I was thinking about was the day-to-day recycling that we used to do. Has that completely stopped now? Like people used to drop their stuff off at the supermarket?
No, everything continues as normal. If someone is getting, if someone has found out that recycling bins are overfilled or whatever it is, just please let me know so I can let the director know where he needs to pay attention to.
Okay, so the stuff is still going off, but it's going through the process that it always did and going off to wherever it goes to.
Yes. Mm-hmm.
Okay, great. Thank you.
And if there's any changes, I will let you know tomorrow.
Thanks very much. I've got all that.
Okay,
I'm done. Thanks, Donna.
Okay, no worries. We're gonna go back to Kayla. Kayla?
Hi there. I'll try to make my questions quick because I know the public is getting restless. My first question is for the Premier regarding the employment situation. Since the lockdown measures seem to that they'll be in place for a while longer, what are we projecting the unemployment situation to be like, say, by May 1st, May 15th, if these measures continue?
Well, no tourists are coming back anytime soon. What we are hoping is, as I've said, is that the testing results will allow us to slowly reopen aspects of the local economy, particularly construction. I would desperately like to see the NRA back out there working at the roads while the traffic is so slow.
Yeah.
But again, all of that will have to be guided by the degree to which the results indicate the virus is present in the broader community. So it's very difficult to make those decisions now until we get those results. But we're going to focus, and that's one of the reasons why we've taken what some may consider a pretty drastic step in freeing up a significant amount of pensions money and putting it in people's hands. We're trying to keep small businesses open, to give them hope that they have access to some funds, that they can keep staff employed, and get construction in particular moving again, because most of those projects, and probably all of those projects, have money approved and available, and the workers are generally still here, so that we can start getting as much of the domestic economy back working as we possibly can, while we try to figure out how we address the thousands of people who no longer have hospitality jobs. Financial services still seems to be doing reasonably well. There had been some rumors of some layoffs. I haven't had any confirmations, but I think our indications so far are that despite the global upheavals, financial services is still holding its own. How long that will continue, I can't but guess, because what's happening in the rest of the world, is what drives the demand for the services that our industry here provides. So I'm hoping to get a clearer steer on that over the course of this week as well, what their current projections are. I know the minister had a Zoom meeting with them, with industry, a couple of weeks ago, and up until then things were still moving along fairly well, but things are generally not getting better in the rest of the world.
Do you have an estimate of how many jobs on island have already been lost and where unemployment stands currently?
No, I don't have those numbers. I'd be guessing, and I'm not even sure I can guess properly. But we hope to have a clearer steer on that. As I say, just about all hospitality jobs are gone, at least some temporarily, we hope, because even the restaurants that are operating at a reduced levels, and obviously all the bars are closed, all the hotels are closed, all of the tours are closed. So that would be significant.
Of course. And you mentioned earlier about being hopeful that NRA workers might be able to get back to work at a certain point. Is there a draft plan that's being explored to see how we might slowly reopen certain sectors?
Well, it'd be a bit of a stretch to say there was a draft plan, but there's certainly discussions going on around what areas would pose the least risk, because while no one has done it successfully yet, there are lots of lessons to be learned about what has happened and what's happening in other countries as they try to reopen. One country that we've learned a lesson already, and we've moved on, is we're not following what the United States is doing.
Yeah. And we're hearing from some of the Nicaraguans who are stuck here that they've gotten some word that they were able to present an official letter of some sort. Their reentrance to the country might be considered. Is there any update to their situation?
If I could come in on that. No, I don't think there is any update. I mean, I've spoken 3 times to the foreign minister, and they are still saying the position remains the same, but they hope that when the situation improves, they will be able to allow those flights to proceed, but we can't send those planes at the moment.
Okay, thank you, Governor. And one just small last question about pensions. Of course, lots of people have questions about that. Would former civil servants who are now unemployed, maybe they went to the private sector and have now lost their jobs, would they be able to access their pensions?
Their private sector pensions, yes.
Okay, but not the pensions they had with government.
No, they're two very separate, distinct pieces of legislation. The National Pensions Law governs pensions within the private sector. Some statutory authorities and government-owned companies do subscribe to them. They will not be able to access the accounts which were created as a result of their employment by the statutory authority or government-owned company, because public servants are not being permitted to withdraw from those accounts. I forget what the other pension law, I think it's called the Public Service Pensions Law, governs pensions for the public service. Those are not under the remit of the elected government, but under the remit of His Excellency, as an important element of the overall civil service operations. And the view, as I expressed yesterday, the view is very firmly that the civil servants are not being laid off. Civil servants are not being asked to take a cut in salary. Civil servants, including those of government-owned or public servants of statutory authorities and government-owned companies, all got a 5% increase with effect from the 1st of January. There is, as we can see it, no logical basis on which we should allow access to public service pensions at this stage. We need everyone to understand that we are in the middle of, we're not in the middle, we're at the start, really, of a global public health and economic crisis on a scale which no one living has ever really known or experienced. We don't know how long it's going to last. And people, everybody, including government, needs to think that we are likely to be in this situation until about this time next year. So if government winds up in really, really dire straits, notwithstanding all efforts that we are making, including pursuing a line of credit, and is forced down the road of having to cut salaries of civil servants, but you've used up the opportunities to have access to your pension funds, we will be, as my late father used to say, really in a hell of a hobble. So let's not operate on the basis that this is going to go away in a month or 2 months or 3 months. Even if we contain the virus, the economic repercussions are going to resonate for, quite frankly, years to come. So we need to be prudent and thoughtful and careful and frugal about how we are spending our money, governments and our own. Because as I said, we just have no idea how long this is going to go on. So that's why we've limited what can be taken from the private sector's pension funds to 25%, because there may be a need further down the road to go back at it again. So, and people don't have to rush. If you don't need the money now, this is in place until the private sector provisions until November. If you don't need the money now, leave it. It's not going anywhere. And then you can decide, do I need to access it or do I not if things get worse for me? Or even if you decide that you don't want to take the risk with the market and you want to withdraw it, put it aside if you don't need to spend it now, because this is going to be not just a long, hot, hard summer, but an autumn and winter too.
Thank you for that answer. That's all I have.
Okay, I believe the Minister of Health has words to say.
Yeah, just I wanted to recognize DJ and his team for giving the second chances, second chance to inmates who are turning their lives around. I want to thank him and the team for this, and also wanted to send a shout out to the command team at the RCIP, working very hard. Also wanted to mention that a very astute Caymanian businessman, Mr. Marshall Levy, passed on, and wanted to give his condolences to him and his family, especially his wife and his children, Harry. Also wanted to note that as a government, we will need to do something about the lines at the banks. I'm getting inundated with WhatsApps and emails and all over the place. Someone stood in line this morning for 3.5 hours, and that was almost 1 o'clock, so they didn't get through. So it's here upon us, and we have to extend the hours. I just wanted to mention that's something that us as a government need to continuously converse with the banks and try to get them to extend the hours. I thank you.
Okay, thank you, Minister. Before we wrap up, I'm going to go back to the Honorable Premier so he can give another special shout out to this resident of ours, this Caymanian woman who is, has lived to see many more years than most of us will probably ever get to see. Premier, if you could just give another shout out to Miss Ethel.
Miss Ethel, in case you didn't hear me the first time, I just want to, on behalf of myself, my family, the government, to wish you a happy 102nd birthday.
All right.
I know you don't have your usual friends and family around you. Like the rest of us, you are being forced to physically distance, but you are in our hearts and our thoughts and our prayers on this special day. Keep strong.
Thank you very much, Premier McLaughlin. Before we go, a reminder again to go online to gov.ky/coronavirus, as well as to eservices.gov.ky for answers to your many pressing issues and concerns there. I'd like to thank everyone who's made today's press briefing possible, and of course to you, the public, for joining us again for another press briefing. We invite you to join us again tomorrow. And coming up, we invite you to take a look at today's worldwide and regional statistics on the coronavirus. We'll see you back here again tomorrow.